Well, hello everyone. Glad you could join us tonight. We've got some exciting news. We would like to congratulate our winners for July and winner for July and winner for August. Our winner for July is Rosemary. She's from Canada. So congratulations, Rosemary. We've already contacted you, but congratulations. And also, a congratulations goes out to Karen. This happens to be a second Canadian that won the Palm Ultimate. So, congratulations, Karen. Tonight, we'll be talking about how light, first of all, how it works, how PBM works. And we have an excellent presentation by Dr. Mel Burchman, who was on our program a while ago. And then we'll also talk about sleep and how Dr. Jenna Flora talks about how sleep can be affected by light. Then we're going to be also talking to a person, well, we'll have a, sorry, not talking to, but we'll be playing a video on Baker cysts and how light can be helpful there, and also from stroke. So we'll be playing these, and then we'll get into an area where we talk about the products, and then we welcome your questions. So for those that are coming in from other countries, from across the globe, we'd love to have you put in our chat line where you're calling in from, and that's pretty neat that we have had people joining us from the other side of the world, India, China, Taiwan, in Australia. So yes, so welcome to everybody, wherever you're coming in from. So now what we're going to do is go into the start of our videos. So we welcome you to stay to the end, because if you do stay to the end, you will be registered to get one of the Palm Ultimate devices and registered as a ballot. And every time you watch, so if you watch 4 times in a month, you'll get 4 ballots put in, and then we'll do the draw. And so just like tonight, both Rosemary and Karen won units. Maybe you're the next. So let's go for it.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about 1 foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
So we'll get into our next video in just a moment, but I did want to mention two of the largest countries or largest number of customers are both in the US and Canada. So if you're in US, tell us where you're in the US, or if you're in Canada, where are you tuning in from Canada? Just drop us a message in our chat line there. So also I wanted to mention a week and a half, well, now it's 2 weeks ago. Well, I guess a week and a half ago, I was in England, London, England, and we have a special page now. If you go down to on the research page and go into PBM 2024, the research box called PBM 2024, you can see our latest boxes of all the latest information, videos, and there's slide decks, and there's new videos that are posted there, and a lot more information in the abstracts that are from this event. There was over 300 researchers from around the world that were there, and I was able to be a part of it and be able to see how light is being used in so many different areas of the body. And the presentations were anything from eyes to musculoskeletal to the brain to all different kinds of uses where the light can help speed up healing and microbiome issues. So just please visit on that research page, go down and go to PBM 2024, click on that and you'll find out more. So we got people joining us from London, Ontario, and Oregon, and Toronto, and Cambridge, and other places are showing up here too. So welcome everybody. Okay, so this next video that we're going to play is Dr. Mel Burchman, who speaks around the world and talks about PBM and teaches. He has a special company called GMA Laser, where they present and teach how laser and light, they call them laser, but that's where they started, but now how PBM can be helpful to the body and training doctors and dentists and chiropractors how to use this. So here we go with Dr. Mel Burchman.
Photo means it's a light, and it can either be a laser light or an LED. Bio means it's a biological effect. And modulation means it can either be stimulation or inhibition. And previously we called this low-level laser, we called it cold laser, soft laser, phototherapy, biostimulation. But it's around us every single day in the world. Take, for instance, photosynthesis as a prime example. Sunlight comes down, it activates the chromophore chlorophyll inside the leaves, and we get the production of energy and oxygen. Well, it's also present in the human body. Rhodopsin's the light-activated pigment in our eyes, responsible for vision. We have hemoglobin and myelin, which are light-absorbing pigments in our blood and muscle. And a prime example in humans is vitamin D synthesis. How does that occur? Well, sunlight comes down, and it activates the chromophore 7-dihydrocholesterol inside our skin, and this converts this to vitamin D3, or the sunshine vitamin. So how did this work? Well, when cells are stressed, nitric oxide binds to the cytochrome C oxidase in our mitochondria, and this inhibits oxygen consumption. This reduces the production of ATP, we get oxidative stress, and we get increased inflammation. So what does that look like? Well, here's a great diagram of it. So we apply our light, it penetrates through the cell membrane, goes to the mitochondria, we replace the nitric oxide off of the mitochondria, we get the production of ATP or energy and ROS, reactive oxygen species. This allows us to get gene transcription, gene stimulation, we go ahead and we get healing, we get better function, and this is all just from applying light. It's incredible how well this works. And this is Dr. Andre Mester. and he is the father of photobiomodulation. And in 1968, he used the 694 nanometer ruby red laser, and he wanted to see if laser light produced cancer. And interestingly, he only used it on diseased diabetic cells. And instead of producing cancer, what he found out was that he got stimulated hair growth and he got increased wound healing. Now, I want you to stare at this picture. I have seen this picture hundreds of times, and every time I look at it, it is still amazing to me. This is the first patient that went from one country to another to be treated by Dr. Mester. Now, look at this, because when I look at this, it almost looks like this has eaten through her spinal cord. This is after this lady had been treated by conventional wound care for a year in Italy. So this is not in a third world country. She was in Italy, treated for a year. She's the first person to go from one country to another. She went to Hungary. She was treated by Dr. Mester just with red light, and after 6 months of treatment, you have healing. How incredible is that? So, photobiomodulation, why should we use it? What's so great about it? Well, there's so many benefits behind it. It almost sounds too good to be true. And until you start to use it and do it, you won't believe it. But these are all true. We get increased cell respiration. We get increased cell energy production. We get increased lymphatic drainage. We get increased endorphin release, increased RNA and DNA synthesis, which gives us increased protein synthesis. And we get increased collagen synthesis, which is important in wound healing. We get a decrease in pain fiber transmission. We get a decrease of post-op pain. We stimulate the formation of capillaries, and this is tremendously, tremendously important in wound healing. We stimulate odontoblasts, osteoclasts, and fibroblasts. So therefore, we're stimulating the growth of bone and dentin and soft tissue. We stimulate nerve regeneration, and we stimulate stem cell production. Now, how do we get our pain control? Well, remember, I was just saying one of the benefits is the increased production of beta endorphins. So these endorphins will go to the binding sites, the receptor sites on the end of the neurons. They bind in here, and they prevent that pain transmission going to the next nerves. So this is one of the ways that beta endorphins will go ahead and prevent the nerve pain transmission, and they decrease pain, and by that they also decrease opioid use. So what effect does photobiomodulation therapy have on general health? Well, we increase the resilience of our cells and tissues. As I said before, we increase ATP generation. We enhance the recovery process. We increase muscle strength, muscle performance. We reduce muscle wasting and degeneration. By the way, virtually every NFL team and tremendously amounts of individual athletes all do this on themselves, Olympic athletes and so on. This really, really works. As a matter of fact, one of my dear friends and her husband's over in Australia, they do this on one of the professional rugby teams, and it was working out so well that to extend the contract, the owner of the team said that you cannot disclose what we are doing to the other teams. I want to keep this as an effect just for us.
So that was by, Dr. Mel Burchman, and he has a company, as I mentioned earlier, GMA Lasers, and there's some great training there if you want to take an all-day laser course, laser or LED, learning about lasers or learning about LEDs. That's a great place to learn even more. So just mentioning that. Thank you, Mel, for that video. So next up, we will be talking about sleep. And I just want to say one more thing. For PBM light treatment, wow, we've seen some great stuff as far as people being able to sleep. Just using the palm light on the top of the head, a few people have reported that before they go to sleep, if they're somewhat wired and trying to get to sleep, that just a few minutes of light treatment seems to have kicked in their idea to sleep. So that's kind of neat. Also was mentioned opiate addiction, and we just completed a study that was published. It was done in West Virginia by Dr. Jenny Flora, and pretty neat how the study showed that light therapy could reduce the cravings that somebody would have on as far as cravings that they would have for opiates, and better sleep and better outlook on life. So yeah, so we had people use it, just pain on, it's really neat. Thank you, Geraldine, that mentions about how Super Palm has been used on different parts, ankles, and we'll get into that deeper later. So now let's go on with the next video, please.
We've seen people that are using, that have tried the helmet, as a matter of fact, purchased the helmet, that the one woman in particular, she said about how improved her sleep was. She went from waking up constantly through the night and trying to get back to sleep, just constant interruptions in her sleep pattern. And she says, I can't believe it. I'm sleeping 7 hours, that she hadn't before. Have you seen things like that?
Oh, yes. Well, and just to go back to our study, one of the big things that happens with opioid user disorder is insomnia or disruption in sleep. Usually it's caused by pain or discomfort when people are going through withdrawals. So then they go back to opioid use to kind of quiet themselves so they can rest. So that is a big takeaway that I'm hoping that people who participate in the study will see like immediate, because we all know that sleep is so critical for recovery in so many different ways, and to decrease inflammation in the body, you have to sleep. So, but as a personal user of PVM too, I sleep better, even though I have a 1-year-old who does not sleep very well. But the intermittent sleep that I do get outside of him waking up is better.
So next year we'll be talking about strokes. So here we go.
I had a patient, her name is Faye, and I asked for her permission to be able to speak to her about her condition, and she gave me permission to go ahead and disclose all the information medically that under HIPAA would be regulated. So she's a very kind, sweet lady. I've been treating her for several years. I have a private practice now as a concierge, and I see private patients. And she came to me after visiting her hairdresser the previous day, and the hairdresser decided to do a deep scalp massage while her head was hyperextended in the bowl. And she's got severe stenosis and arthritic changes. And she comes to me the following day saying that the right side of my face feels really tingly, and half of my lip feels like it's been shot with Novocaine, as a dentist would. And I examined her and I said, Faye, I believe you have a stroke and we need to get you to the emergency room right away. Well, in fact, they transferred her from the emergency room right to the hospital, and she did have a huge stroke with dissection of the artery. And as a result of hyperextension in the bowl, and that's not the first occurrence that's ever been documented that hyperextension can cause strokes, particularly in that situation. So I told her that there's this new type of therapy, the photobiogenic therapy, that uses near and far infrared to penetrate deep into the structure and subcutaneously. And if she'd allow me to have 6 treatments, which I believed would have been adequate to resolve the situation. By the 3rd treatment, most of the numbness was gone and regained functions of her hand, leg, and on the right side of the body, which she had lost because of the hematoma compressing the brain. And by the 5th and 6th treatment, she was completely balanced, walking, riding her lawnmower, loves horses, was back on her horses. And yes, so definitely that was a way of showing of how you could penetrate through the skull and actually reduce a hematoma or a stroke type incident, which is a pretty significant, serious, if it's untreated, can result in permanent brain damage. The sooner you get to it and the faster you can work the healing process, the faster the patient will respond and the better the outcomes will be.
This is a young woman with a stroke, and she was able to, due to the limitation of time right now, we're just going to pass on this, but she had her hand was up near her neck. She could not straighten out her arm, and as soon as they try even a little bit, the muscles were so tight and pulling that she couldn't, without severe pain, she couldn't pull it much down. And in 20 minutes, she was able to pull her arm straight down to the side, and she was able to have better, no pain. That was the big thing. No pain across her back and in the neck area and everything. It was very, very painful coming in. And 20 minutes later, there's no pain across her back, and she was able to straighten out her arm and also her fingers, which were also curled in because of the stroke, because of the muscle control. Carla asks, has there been any results on stroke victims even many years, 18 years after the stroke? Well, Carla, as about 2 weeks ago, I wouldn't have been able to say anything about that. But as of just about, I think it's about a week and a half, 2 weeks ago, I got a call from a dentist. And not only did the light help his wife for an issue she had for, she had her limb amputated and she had a lot of pain and she couldn't use there was no chance of prosthetics, to 3 months later using the light every day, to her being able to use the prosthetics and not have pain. He was elated that it was able to help his wife. So in this case, what happened is he decided he would talk to his friend, a close friend of his who had a stroke 20 years ago, 20. And so that's 2 more years than what you're asking about. But he had, ever since the stroke, he had a difficult time to be able to talk. So that was an ongoing thing for the last 20 years. So his dentist friend decided to use the light after watching some of my webinars and use it around the skull. And the next day after the treatment, one treatment, the next day he was able to speak clearly. So it was pretty neat that we were able to see such a dramatic change.
Stroke recovery. Do you have any information about that?
Yes, strokes have also been shown to be beneficial. As a matter of fact, one of the individuals that I'm a close friend of mine, he's 82 years old, and he had this past year a stroke on Good Friday. And it was about 2 months later, and I had talked to him. He was in the hospital for a bit. He came out and he spoke with a very strong slur that made it almost impossible, if not impossible, on the phone to understand what he was saying. As well, he had difficulty with his walk. And I finally convinced him to take some time. He was not fearful about the technology, but just taking the time to come drive across the city for 20 minutes and give it a try. So he finally did. And the day before, I could barely understand him on the phone. And the next day,
after the treatment, I could understand him clearly. That's how, and that was only a 4-minute treatment. So, and does everybody respond that well? No, but I mean, in his case, this is what happened. A concussion. The kid went totally back to normal after throwing up, after seeing double, and also headaches. After 3 treatments, he was a normal kid. And that took place over the course of a week. So there's a lot of evidence coming out that this could be very beneficial to not only strokes, but and there's other rat studies and things that one can dig into, but also the whole area of concussions and dementia. And my hope is this new study that'll come out. Well, it's not going to come out yet. It's got to go through the trial, but will be specifically with my helmet and ChemoBrain. And we're hoping that we can show how much of a benefit this can be for those that are experiencing difficulty in thinking and processing after they're getting their chemotherapy treatments.
PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have 2 different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can.
So just mention also some of the mentions there about timing and studies and that. So the study, as I mentioned earlier, was completed with the helmet for opiate addiction and depression. So that is now posted, so you can find it on our website. So now I get into the products. We have the Palm Professional, and the other device, the Ultimate. Both have the 660 and 810 nanometer wavelengths. So we do 660 only right now. So we have a high amount of optical power, as I mentioned earlier in the video. And then we have the 810 nanometer, which doesn't look very impressive, but you can see the little purplish dots there, but you can definitely feel the energy coming from it. It's just that the 810 has the wavelength that's longer, and that longer wavelength can penetrate deeper into joints and that. So between the Palm Professional and the Ultimate, it's just that the Ultimate has more power. Now, at the time of the one video, this was our absolutely our best model, which is the Ultimate. We have now added the next model up from there is what we call the Super Palm, which has the 660 nanometer wavelength, same power as the Ultimate, but instead of the 810 nanometer, we now have 1050. So you can see the purplish dots here, but when I look at it, it's totally invisible. All I see is the one red indicator light here to tell me that it's going. Otherwise, I wouldn't know, but you can definitely feel the energy from it. But it's been shown that the longer wavelengths have the potential, depending on the tissue trying to penetrate, can actually penetrate a little deeper. So when we're talking of trying to treat into the brain, we're trying to give it all we can. So the 1050 is probably a little better wavelength to get a little deeper as opposed to the 810. But there's a lot of studies on 810 and how it's been useful. So we have those different Palm devices, and like I say, the Super Palm has the 1050 nanometer wavelength as opposed to the 810. And then we have the helmets. This helmet in particular has the 660. Let me just see here for a sec. The 660 nanometer wavelength and the 810, and you can just see it inside there. So it has those two wavelengths, and we also on special order have the 1050. This is basically like having 10 of the Palm Professionals equally distributed over the entire brain, and that's what we have with our helmet. And what was used in that study, and in this case it was only twice a week for a total of 3 minutes, just using the near infrared setting, where they had that kind of benefit, a significant benefit over the 2-month period of treatment, only twice a week with 3 minutes each time, and significant improvement on the brain. So it's amazing how if you have enough power with light that you can do it in a short treatment and you're getting very good effect. This is our mini canopy. This is the equivalent of 15 of the Palm lights, equally distributed. If you felt the energy from this and you felt the energy from that, you would feel the same. It's just the fact that the power density is the same, but now you have such a large area that you can treat the entire back and neck in one treatment. So those are our different products. Plus we have also the I'll just bring this back in for a sec. We have the canopy device, which is more for a clinic, and it can, people can own it as well for personal use, but it has 6 of these in a 2x3 array, and so it does a very large area of the back, or wherever you're trying to treat the legs and that. So it's a much larger device, obviously more costly as well. But it's the whole thing that we do is the power density is very intense. So the sun actually produces all the wavelengths across the sun, going from the blue to the UV to the blue to the green, yellow, orange, red, near infrared, and then far infrared. And the far infrared, doesn't penetrate. As soon as you go beyond 1300 nanometers in wavelength, there at 1350, the water in your skin absorbs all of those wavelengths. So it can't go much beyond the water in your skin. Wavelengths between 600 nanometer, which is kind of like an orangey red, to 1350, those wavelengths can penetrate. And as you get longer in the wavelengths, as you go from 660 nanometer to 810 nanometer or 1050, it's a longer wavelength, and in that case it can actually penetrate deeper because of the nature of what happens with the wavelengths going in. So the reason why we have two different wavelengths, the 660 nanometer and the 810 or 660 nanometer and 1050, is the 660 is a wavelength that is absorbed by the blood, and it's a high amount of absorption in the blood. So it's actually stimulating things within the blood, and you can see how it's going right through my hand here. And so it still has penetration, but so that reaches into the blood. The 810 has the wavelength that can actually, or 1050, and when it comes to our super palm, is one that can treat much deeper for areas inside the shoulder or hip or brain. So those are the areas that that the longer wavelength can get into. So now what I'd like to do is like to answer any questions that you might have. So I saw there was a question here about somebody spraining their ankle. So if you were to use the super palm on your ankle, it's something that I would suggest you treat multiple times a day if you possibly can. And I would look at bathing the entire area with the red and the near infrared, both wavelengths. As far as timing, because it's not as deep as, let's say, something like the hip, and I would recommend, and because there's a lot of stuff going on with the lymphatic system, probably to treat around the whole ankle about 20 to 30 minutes. You'll get and you could be treating on the back of the knee as well for the lymphatic system. But about half to 3/4 of the time I would be spending with the near infrared, so you can get more penetration as well. So not only are you going to help the blood flow and do other things, but you're also going to be able to reach a little deeper. But I would say that's the range of what you would do. I mean, you could probably do it in a shorter period of time, and hey, if you only have 10 minutes, go for it. Use that 10 minutes, and again, probably half to 3/4 of the time. If you're doing something like your hip or your shoulder where you got much deeper area, that's where you want to spend about 3/4 of the time that you're treating with the near infrared. So because that's going to get you the extra penetration. Also remember, when it comes to inflammation, such as something that happens from a sprain or from other things, the lymphatics, where you have lymphatic drainage problems, it's not draining the area, you have swelling, that remember to look up. We have a chart on our research page that shows how the lymphatic system is connected, and what you want to try and do is help the lymphatic system to drain the area where the swelling is. So it's kind of like if you were to have a river, you would first open up the very end of the river if there was clogs there, and work your way back to the source. So it's kind of like if you had swelling in your ankles, you might want to start in your belly area. There's certain places where the groin, then go to the back of the knee, and then go to the ankle area. So you're opening up the flow downstream first, and then coming backwards. So next, let's see what else we've got here. Question came in: where would you place the palm unit? I've just gotten some people that have told me, so we're going to find out more as this goes forward. But right now, they just put directly on the top of their head and did a couple-minute treatment. So probably, again, I would just use the standard that we have, which is 1 minute of 1 minute of the red and 3 minutes for the near infrared. I'm sorry, I misread. You mentioned, I thought I read ankle because I didn't have my glasses on, so so let's see, it's the arch area, arch in the foot. Okay, so just, it's obviously not very deep then, so much shallower, so less time. And then if you're doing the knee, much longer period of time. So good question there. Thank you yeah, thank you. I've asked her, which product is, I've asked her. Okay, osteoporosis, where is that occurring? You're trying to help for bone growth. I would suggest the best devices to use for something like that would be the Ultimate or the Super Palm. If you're really financially tight, you still can get good success with the professional. Okay. So we do, as Jennifer posted for me, the lymph node diagrams. Thank you, Jennifer, for doing that. All right. Well, I think we're okay. Susan's talking about treating her achy hip right now, so hopefully that goes very well while she's watching tonight. So great. Well, I think tonight I've answered the questions that have come up, and we welcome you to next Tuesday evening. And so thank you for joining us tonight. And again, congratulations, Rosemary and Karen. And hopefully one of you will be a winner for September. All the best for tonight. Good night, folks.